Mommy, you have spoiled it. You have spoiled it.
See our cushion the way you can.
It will not spoil.
1, 2, 3, 4. So let me say this again if it wasn't clear before.
Public health is different from nursing and medicine, okay? Public health is different from nursing and medicine, and public health is not lesser of a course to study than nursing and medicine. It's just a different course to study in the field of health. And I've already done a comparison of the salaries I'm gotten in medicine, nursing, and public health. And you can also catch this in my book on how to build a successful career in public health. So now, how does public health differ from nursing and medicine? Let me break this down in 6 points. Number 1, when it comes to the unit of their study, nursing and medicine focus on the individual patient, just 1, 2, 3 patients, okay, at a time. But public health focuses on individuals, plural form.
Of a community.
A community made up population, okay, made up of several groups of people. So they can look at, for example, Lagos, Nigeria. They can look at Nigeria. They can look at sub-Saharan Africa. They can look at Africa and the world globally. For example, when it came to the pandemic, okay, COVID-19 pandemic, you can see that public health actually covered looking at the whole world. So while doctors and nurses are focused on treating patients that come into the hospital, public health actually go out into the community to check, what's wrong, identify trends in diseases, and find out how to prevent it by educating people, improving policies, and all that.
So we are not focused on the individual. We are focused on the individuals, okay? We're focused on the population.
Secondly, nurses and doctors focus on curative care. That's the diagnosis and treatment of a disease, while public health professionals are focused on comprehensive care. So we take into account the prevention, promotion, treatment of diseases. So we look at the wider aspect. That is why some doctors, or most doctors and nurses, are entering into public health to have a deeper understanding of how to prevent diseases and also treat those diseases. When it comes to the target group, medicine and nursing is focused on people who already have the disease, okay, while public health professionals focus on both the healthy and the ill, okay, those who are ill. We are working towards helping people that are ill get better, like doctors and nurses, while also making sure those people who are healthy remain healthy, okay.
That is why we have health promotional activities under public health.
Number 4, nurses and doctors don't take into account other factors that led to someone getting ill, okay, but public health looks at the external factors to that person getting sick, okay. For example, we look at environmental factors, social factors, accessibility of the services in that person's community. Was it actually available for that person to actually get to treat the individual, the person's preconceived idea on that disease? Was the person properly educated? We take into consideration all these other factors that doctors and nurses don't really look at when treating that patient. So we actually take these factors into consideration so to actually prevent it from recurring again. So remember, we work towards promoting a healthier living environment for individuals in the society. Lastly, the salary. Of course, I've done this before. It depends on the job position that public health professional occupies, okay. So and again, when it comes to public health is not just a field for people that just did BSc in public health, for example. Doctors, nurses are entering to do masters in public health and further by doing PhD and the rest. When it comes to the salary, okay, a normal medical doctor working in a hospital setting might likely earn more than a public health officer, depending on the job position the public health officer is currently occupying. You can't compare to a normal medical doctor that works in a private hospital to someone, a public health officer or professional that works in the World Health Organization. So it depends. And you can't compare a medical doctor who is working in a hospital setting compared to a medical doctor who studied on public health doing their postgraduate studies that are working in non-governmental organization. Okay, so they earn more. So that is why I said when it comes to comparing their salary scale, it depends on their job position and their field, okay, their field and where they are actually working, their job setting. So you can actually really compare it, okay. So in health, they earn money, okay, because we are focused on making lives better. So do not disregard public health when comparing it with medicine or nursing. It's just a different course. So if you want to study public health, all you have to do is buy my book on how to build a successful career in public health. So you don't get stuck on a lower position, because you can get to build up your career to make a better living for yourself. Okay, I hope that's clear.